Hello, and thank you for joining us tonight for our free webinar, Acupuncture Sports Medicine Beyond What You Learn in School, panel discussion moderated by Whitfield, Reaves, and featuring Chad Bong, Jenny Nieters, and Kenji Hirabayashi. My name is Jeff Bloom, Education Marketing Manager at L.OM. For over 40 years, L.OM has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. With our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned practitioners and educators. I would like to take a moment to acclimate you to the webinar room. To the right of the video screen, you will see 3 tabs: Chat, Questions, and Polls. To chat with other attendees or to communicate any technical difficulties, please use the Chat tab. For questions of our panel, please make sure to use the Questions tab to ensure that we see them. Please note that each webinar is recorded, and immediately following the conclusion, you will all receive an email with a link to view the video on demand. You may always visit our blog and use the free webinar tag to find all of our previously recorded events. From neuroscience to sports acupuncture to Chinese herbs, you'll find something interesting for every practitioner on the L.OM blog. Now for our featured moderator. Whitfield Reaves has been working in the field of sports medicine since he first began practice in 1981. He earned a Doctor of Oriental Medicine degree in 1983 that included a thesis entitled Acupuncture and the Treatment of Common Running Injuries. His experience in sports medicine includes the 1984 Los Angeles Olympic Games, as well as numerous track and field, ski racing, and cycling events nationally over the last 30-plus years. He has been in the forefront of acupuncture sports medicine field, emphasizing the integration of acupuncture with orthopedics and anatomy. He's the author of the Acupuncture Handbook of Sports Injuries and Pain, and his popular acupuncture sports medicine apprenticeship program uses a small group mentorship style in the instruction of orthopedic-style acupuncture. And you can find dates at his website, which is whitfieldreaves.com. So please join me in welcoming Whitfield Reaves and our panel.
Thank you very much,
actually,
Jeffrey.
Really quick, guys. In the bottom right-hand corner, there's a little bell icon. If you guys can click that, it's going to mute all of the notifications. And now I'm going to leave.
Okay, well, thank you, Jeffrey. We involved in acupuncture sports medicine love L.OM, and they're so supportive of all the work that we do. And thank you so much, L.OM. Thank you, Jeffrey. I'm going to let each of my esteemed colleagues introduce themselves as we kind of proceed through here. But I just want to comment a little, make a little statement, and then get out of the way, because this is about them talking and not me. But I want to talk about, I just want to mention, when we break down the whole idea of learning into yin and yang, we have maybe yin would be our substance, our material, our ideas, you know. Yang would be the empirical system, the clinical practice, the way we see this stuff in action and see if in fact our ideas are effective or not effective, you know. So a great technique, a great learning process is taking this idea, this point or this technique or what have you, and then testing it, right? And we all know we come from the empirical tradition. Now, within the context of our group, our community, Acupuncture Sports Medicine, I use the word community because we really work together. We teach together, we work together, we share our clinical ideas together. And so many of the techniques that we teach haven't just been developed by me or one person, you know, but a lot of us, and we communicate. We go, this is working, this isn't working. Why do you think? So the empirical tradition works well, works wonderfully to get really effective techniques. And within the context of our 3 panelists, Jenny Nieters, Kenji Hirabayashi, and Chad Bong, all of them have taken these techniques and then use them in a way. For instance, I talked a little bit about the core muscles and all. We came up with a protocol, you know, assuming that we had to do something with the wraparound core muscles, because that's what we do with lumbar pain and, you know, discogenic pain and what have you. And Jenny probably has done more treatments using that technique or those variations of that technique than anybody else. So she has just taken that and run with it, gotten very good results. She works for the San Francisco 49ers. And so this has been techniques for her patients and for elite football players, you know, and you know, and so all of this community that we have works differently. For instance, Chad helped me write this book, and Chad Bong is a co-writer in my book, The Acupuncture Handbook of Sports Injuries and Pain. He used his exercise science to help, you know, get this material right, but he's taken much of the techniques into the track and field world, and not exclusively, but he's worked with some of the elites, you know, on the planet in terms of runners. Kenji worked for a handful of years for a Division II basketball team in his area and brought these techniques to collegiate basketball. But even more so, he lives in one of the prototypical active, you know, residences anywhere in the country in Marin County. And he's got cyclists, he's got mountain bikers, he's got runners, he's got hikers. He has all these active people that he brings these techniques to and incorporates them along with his other interests with herbal medicine and what have you, you know. So all of the integration of the kind of material that we teach, we have to remember it comes from the empirical tradition, and we have to remember that each person has to make it their own. You know, you have to have an authentic relationship with this material. You have to make it work for you and make it your own and adjust it. And these three colleagues of mine have done that magnificently, each in their different way. And so we're going to start the panel with Jenny Nieters. I'll let her introduce herself. But the question that they're going to ask is, what specific skill or skill set that you needed to develop after completion of your basic training in acupuncture school? You know, things like anatomy, therapeutic exercise, trigger points, et cetera, et cetera. Anything that is important to you that you needed to help you on your path to get you where you are now. So this, we'll have each of them answer this, but we'll start with Jenny Nieters. Jenny, it's all yours.
So when I first heard that question, I'm Jenny Nieters. I have a practice in the San Francisco Bay Area, and it's been my great honor and pleasure to be able to assist and teach in Whitfield's program since 2015, which has really changed the course of my life in terms of having a mentor and really being able to deepen my understanding of orthopedics and acupuncture. And then also it's my third season, as Whit mentioned, with the San Francisco 49ers, which has been such a pleasure to be able to bring our medicine, even though the 49ers have a long-standing tradition of having acupuncturists, to be a part of that has been an extraordinary, joyful thing for me to be a part of. So I'm grateful for that. But when I first heard this question, I thought, oh gosh, anatomy and assessment and palpation and the needling, you know, it's like that. I was so excited about all of these things. But then I thought, well, you know, while I'm at the stadium this week, I'm just going to ask my players, you know, so this is the panel that I'm doing, and this is the consideration. What do you think is necessary for a sports acupuncturist? And, you know, the first one said, well, you know, we're here and, you know, winning or losing, it's every week we're riding these highs and lows, and we have our personal lives, and we're just, you know, trying to show up and work, and you show up and you're here for us every week, and you really listen to what we need, and you don't give off a weird vibe or make us feel weird. Or I was like, okay, well, all right. So then I asked the next person, and he said, you really listen, and you hear what I'm saying about my body, and not just my body, but my life and where I'm at, and whether or not, I want, what else is going on with me. And I was like, okay, it's two people saying almost the same thing. It's kind of interesting. So this quality of listening, and every single other person had that same response, that they felt heard. And so finally last night I was at someone's house, and I asked him the same question. And I said, what? So tell me again what you said on Tuesday. Can you repeat that to me? I just want to make sure I understood. And he did. And I said, so do you not feel listened to or heard by the other people that you work with in your lives? Because I feel like as acupuncturists, that's one thing that we really do for people, is listen to what they're telling us is wrong, and to what their body is trying to tell us too, with its movement and with our assessments and everything else. And what I really got, again and again and again, is that people feel very much unheard, and that we as acupuncturists have this opportunity to listen and hold a space for them. And so I feel like if you are not already doing that, they really drove it home to me that listening, and also, like when I'm listening to my patient, and my agenda is gone, their experience is what is foremost, and my orthopedic assessment is part of my listening, and my palpation is part of my listening, and even my needling is part of my listening to them, like listening to the tip of the needle to see what depth of tissue I'm in or something. So it sounds like, and they specifically mentioned, we get needled by PTs and by athletic trainers, and we don't like it. And one person said, and we don't like to be hurt. And if, people hurt us, we're not going back to them. And that's why we like working with you. It's like we get results and we're not hurt and we feel heard. And I was like, okay, well, that's just like my whole idea of what I was going to say to you guys is now completely changed. And it's about listening. So.
Wonderful, wonderful.
Yeah.
I appreciate that, and there's lots of truth in there. Yeah. Kenji, well, how would you answer that question? And
it's interesting. Yeah. So first off, what did we learn after school? The funny thing is, I have been in school forever, so I've learned quite a bit in school. Long time getting my bachelor's degree and then my master's in geology. And then lo and behold, what do I have to do but go back to school again for acupuncture? So I've learned so much during school that there's little left after school, but there's always more. And I really think what drove me to get to where I am today was the idea that I just had to have the confidence to be able to speak with other people. And when I have that confidence, I can talk with physical therapists, with doctors, and the referrals, then I have that knowledge and the referrals start coming in. So what I needed to do to get that confidence was a couple different things. One, the biggest leap that was made for me was taking Whit's course. And so the idea was you have to come out with this baseline competency where you feel like basically I want to see results. And I want to get, you come out of school and you have, I don't know, a percentage of good results, and it's not great. And so for me, that was I found that discouraging. And so what I needed was some way to immediately ramp up that number where my percentages were much higher. Then of course people start talking about you start seeing more people, and just seeing more and more people was the key to really getting, and once you have some basic skills to really get moving forward. And so that, for me, really took off when, you know, I had this base knowledge and I started seeing more and more patients. And I was looking back at the patients I love to see. I have the physical therapist, one physical therapist I do tons of cross referrals with. She comes and sees me, and I'm like, oh, she's on the schedule. And so what I get to do is we're talking, and I learn so much as she's trying to get a treatment, and I'm bugging her with all these questions. You know, she's like, oh, have you heard about this technique where, you know, it's blood constriction and you do the workouts with blood constriction, and she's all into that. And I'm like, oh, wow, no, I'm not familiar with this. And so I looked into that. And so talking to my patients, I've learned so much. And another guy, so again, you know, you start gearing more towards athletics. That guy comes in and he's like, yeah, what I do is I go for this morning ride, and what the key is the bulletproof coffee first thing in the morning, and it just drives me through. I'm like, what's bulletproof coffee? I have no idea. I don't drink coffee. I'm not interested. And he tells me all about this. You know, he's so into all these certain things. And again, I just listen. I even went online and I got all the ingredients in my cart for bulletproof coffee. And then I was like, wait a second, I don't drink coffee. I'm not going to have bulletproof coffee. Good for him, not for me. So listening, just like Jenny said, is, you know, I learned so much from my patients. And if you just have this enthusiasm where you want to just learn more and more, you get there. But again, having that, you have to have that baseline competency. And I really wish that, I think WIT's program would be the perfect thing to have throughout all of schools, to make sure that's the baseline competency to get out, because that helps our whole profession. Where, you know, how many times have we heard, oh, I've already been to an acupuncturist, you know, they have nothing happened, but then they see you and they're like, whoa, that's different. So that's where I'll start.
Thank you, Kenji. And I just would like to add with Kenji, you know, Jenny has done some amazing things, and Chad has done some amazing things with it. Kenji always brings the cool to our teaching. Whenever we teach and Kenji's there, he brings the cool. That being a
I would add that one thing you got to do is you got to find an apprentice. And what you have to do is just be a pain in the butt and keep bugging somebody, perhaps named Whitfield, that you want to help them teach. So that made a big difference.
Cool. Last but not least, Chad Bong, who's in Philadelphia, and Chad and I go back the longest of everybody in the group here, and I love and appreciate Chad dearly. So Chad, tell us about yourself.
Tell us about myself. I thought I was answering questions.
Answer the question, all the better.
So I would definitely third, I guess, the whole listening to your patient thing. I think it's one of the things that separate us from all of, you know, a lot of other professions, is that we can spend time with people, we can talk to them, and it is a huge separator. It's one of the things that people come in and say all the time, like, oh, like, how did you figure that out? Like, I've been to all these other people. I was like, I spent, you know, a half an hour talking to you. Nobody else has spent a half an hour talking to you. So we're able to like find all these little things that other people just miss. And sometimes that's the answer to the problem, you know? But I won't keep going on that one. But yes, definitely, like, one of the baseline skills you need to learn is communication. Just sitting there and listening to what the other people have to say, and not jumping to conclusions as they're saying it, but actually listening to what they're saying, and then moving on from that. But yeah, I mean, this is a endless topic, I think. I think the things that I've thought about the most since getting this question are needling techniques, just the feel of needle. And Jenny kind of mentioned like what the tip of the needle feels like and what tissue you're going through. Something I just don't remember like learning in school. I remember like learning to put needles in people. I remember learning like accurate acupuncture points. I don't remember anybody like sitting there and being like, this is how the needle should feel as it goes through all of these different tissues. I mean, I probably got that while I was still in school from Whit, because I started doing, this is a little foggy for me because I started helping Whit write his book and helping Whit teach while I was still in school. So I got this huge jump start on this acupuncture, the sports acupuncture kind of thing that I don't think a lot of people have been lucky enough to have while they're still in school. So I had access to Whit's 30 years of information and helping them dig through it and decide what to use and things like that while I was still in school. So it was a great boost to me getting out of there. But so needling is one big thing, learning what things feel like, taking the time to see what things feel like. So I definitely think that's part of it. And anatomy, which I think they'll kind of go together. These are kind of one thing. And I had a huge base in anatomy. Exercise science, undergrad, exercise science, graduate school. So, studying biomechanics and muscles and physiology. And then massage school while I was in grad school for the exercise physiology stuff. And then worked in the personal training in massage world. So I was spending all this time around muscles and understanding them. And then went to acupuncture school, which isn't a muscle-based thing typically, but then met Whit, started working with Whit, and started to put these 3 worlds together. And, I would have said at the time I had a ton of anatomy knowledge, probably not the thing I need to spend all my time studying. But now I look back and I'm like, I knew so little about anatomy at that point, and I've gone so far. And I think teaching was a big tool for me to learn that. I guess that's the next question. I'll hold off. But I think anatomy is a big thing. I think even those of us who think we know a ton about anatomy because we've spent a lot of time in it, I think there's just, it's such a deep thing. And then taking anatomy and learning how to lay over all of the trigger point, referral patterns and how they all match up. And, at a couple people this week, a super high level squash player. And he had, what he thought was a upper hamstring thing. What he'd been told for a long time was an upper hamstring thing. And really, I just was digging around in his glutes, his glute medius or glute minimus, and completely recreated his pain. And, he was in a lot of pain and a really big tryout thing he was doing recently. And, needling in, I almost completely ignored his hamstring. I put a couple needles just so he'd feel like I did something, but I really just went after his glute minimus, glute medius, and I just saw him tonight and he's so much better. Playing pain-free, and squash is just one lunge after the next all night long. So just getting to know that anatomy deeper and deeper and deeper, I think is just extremely important. And then with that, understanding prognosis of these things. So how long are these things going to take? What things can you treat? What things can't you actually fix with people? And being able to kind of tie all that together, go back to communicating with your patients and telling them, what they should be looking out for and how they, what we should expect. So how's that?
Wonderful. Okay, I'm going to throw a curveball to you all. I'm going to go to the third question. We'll come back to the second question. Okay, so the third question was, at your present level of accomplishment, where you guys are right now, name one area that you would want to improve your skills in today. The one area that would make you much more clinically effective. What would you really want to build on of, listening or anatomy or needling or what have you? So let's see what you all could do with that. If there was in fact one thing that would be most important for you. And I don't know. Kenji, why don't you start and we'll see where we go.
Let's see. My first thought would be I want to I think of going to Jenny level with my anatomy geekness and just like know every single thing that could possibly go wrong with a person. But that's not really how I work, fortunately or unfortunately for anybody. But I think the best thing for me is figuring out differential diagnosis. And so I will have to know that anatomy. And then, like I mentioned, learning your stuff, the tests that we go through, that takes care of, what do we decide? 85% of everybody who walks in your door. And so what you want to do is have those other people who you helped greatly, but they still have a little bit of something going on, or for whatever reason, you just miss it. That keeps you from being at even a higher percentage, which I've talked about. I always want to get to that better rate of success. And so the idea would be, well, it's a combination of my diagnosis. Like I think these major muscles are involved, but there's also this involved. So that takes some anatomy knowledge, and I need to know how to do the assessment to find that little muscle that's the issue. And then how do you needle that? And like Chad was talking about, Jenny, about having that precise needle. Oh my God, today I did a lateral epicondylitis, and I remember when I first practiced, I was just like, oh yeah, it's somewhere near the lateral epicondylitis. And how careful do you palpate? Well, whatever you got time for. And I just, I would always do needles all around there. And then even after taking Whit's class, I still was like, okay, it's going to come off here. You're going to do transverse, more oblique, and then you get into that muscle. But now I'm like, today I just took forever, and I was palpating. I was moving his hand. I'm like, this is this, how about this? And cross fibering along all the way, following that tendon. And you just follow it perfectly. And you just do the nice, gentle needle. That's the difference between blowing it up or totally being beautiful treatment. And he left here and he was already like, that was immediate. And it just having that perfect diagnosis, the perfect treatment plan, you'll really get there. And so what I need to do is just really perfect that skill. So that takes assessment, anatomy, and precise needling. More than one thing.
And maybe another 20 years.
Yeah, I mean, you can't beat the experience, right? I mean, my God.
Can't rush it. Yeah. Well, what about you, Chen?
Everything, but it's all, you can just always add layers to every single thing, but for me, the weakest point for me is the internal medicine, the whatever, all the stuff that we actually learned in school. It's the stuff that I'm the weakest at. So I definitely think that I need to spend some time learning some system and really getting good at some system, so that I have a system to kind of fall back on. It's never like my focus is always going to be on the anatomy kind of stuff, but because that's what I enjoy. But I need like a really good system to help all these people who have other things going on, or have something that is related to their issue. Whit has his Korean Constitution stuff that I've played with over the years, and I learned TCM in school. There's all these things. I think maybe really getting to understand some neuro acupuncture stuff might be something that would really work for me, because it still has that a strong anatomy base to it, which is definitely a passion of mine. So maybe that's the road I need to go down, but I need to really study and master some sort of system on the internal medicine stuff.
Okay, Jenny, what about you?
Well, I mean, I'm always attracted to the next shiny thing, and I want all the knowledge. And so what I actually need to do is focus and trust that there's other people in the world that can handle strength and conditioning and the fascial stretch therapy and the egoscue and the postural work and all the things that I'm like super excited by, and see if I can be the best at needling, because none of those people can, while I can do what they do, like those people can't do what I do with the skill that I can, that I have the potential to develop because of the attention I'm putting on my needles and my feeling attention as I'm putting them in. So yeah, so I constantly sign up for classes, neurokinetic therapy and dissection and cadaver, and Whit constantly tells me to focus on being an acupuncturist, because like that is what I am up to in life. So yeah, so that's me. I need to be the best at needling that I can be, and to bring my full attention to that as much as possible. And I think that the best thing I could learn that would help me with that, the thing that I really love about orthopedics is the mostly the instant gratification that Kenji was talking about. And it's like, so finding the assessment that leads me to the right needle, that then leads me to reassessing, that shows me that something changed. And so those types of assessments are really addictive, along with those kinds of needles that get results like that. So that's what I want more of in my life, more than all the other things. So that's, yeah, it's sort of addictive, orthopedic acupuncture.
It certainly is fun.
Yeah.
Learning it is fun.
Yeah.
Listen, I want to answer this one question. You all can add to it. Does the use of acupuncture ever reach the level of the Olympics, et cetera, et cetera? Olympians are wildly successful users of acupuncture. Chad, everybody here has treated Olympians. And I'll just make it real brief. Generally speaking, at the Olympics, you can have a certificate, be certified by any country to get into the village, which then means you can get into the medical tent and treat whoever wants to be treated. Or you can be at the Olympics and be in a private setting and treat anybody who wants to be treated. So many athletes will bring their own acupuncturist and get them housing and what have you. Historically, the United States has been pretty rough on acupuncturists. Early on, you needed to have dual or triple skills. So if you were, say, a chiropractor, physical therapy, and an acupuncturist, then you could get in the early years. Just an acupuncturist wasn't enough. You needed to have more ability to do more things that they viewed as important. So I don't know, and maybe one of you all know if this last round was any more helpful from the U.S. Olympic Committee. Historically, they're awful. Historically, the athletes, like in Boulder, Colorado, where I was for many, many years, the athletes wouldn't even go to the Olympic Training Center because they felt like the information and the techniques and what they were offering was so primitive and, just wasn't on the cutting edge. So a lot of times athletes don't even listen to the U.S. Olympic Committee in that sense. Other countries are much more on that cutting edge, and acupuncture is just normal. So I know in the '84 Olympics, I went in with other countries, and so you can get that certificate from other countries, often by just volunteering and saying, hey, I'll treat your country for free if you can get me a credential to get in. So so you got to get in the Olympics somehow, and the United States hasn't been as easy as other countries, or you just don't even worry about that, and you just go and you treat your athletes privately, in a private location. But yes, you said you're seeing the swimmers with cupping. Obviously, there's lots of acupuncture now. I don't know in the case of the swimmers if those were physical therapists or trainers, or if they were acupuncturists. I'm just not quite in the active scene so much as I was before. So I'm not sure if it was acupuncture or other medical person that was doing the cupping in that sense. So that's an answer to your question, perhaps. If any of you all have something to add. I know, Chad, you were treating lots of Olympic track and field athletes.
Yeah, I had 4 people in the Olympics this go round. I probably could have went to the Olympics this time, either through the U.S. Track and Field Association. You had to be working on it pretty early, and basically one of the easiest ways in was to be working on multiple Olympic level athletes, which I had. So I probably could have gotten in through that. I never looked into going through the whole, whatever the process would be with the U.S. Olympic Committee. Probably the easiest way for me in there would be to volunteer as a massage therapist at the Olympic Training Center, and then try to follow the massage therapy road into it, and then just do acupuncture when I got there, probably. But I certainly could have went to the last 2 Olympics with just went with one of my athletes. I don't know if I'd had access to anything. They probably would have had to come to a hotel room to get treated, but I certainly could have went to the last 2 Olympics. Obviously, Tokyo had problems with COVID about anybody going to there, but yeah. And they're definitely getting acupuncture. A ton of these people, almost every one of them I treated has been needled in some manner before. It's just not always acupuncturists doing it. So, but yeah, everybody's getting, needling is a thing now. Everybody's doing it. Everybody's getting it done.
I also had 6, maybe 7 people that I had worked with at the Olympics this year. And I had a dream that I was going to go be there with them, but with COVID, that definitely did not happen. Or 2020, whenever that was. Time is a blur. Anyway, so, but with the rugby sevens community from South Africa, Fiji, New Zealand, and Team USA. So I probably could have gone too. And, but just with the COVID situation, I didn't prioritize that in my life. But they want it. Everybody wants the treatment. The athletes do. So, yeah.
Cool. Okay, well, look, this is going to kind of fit right into this. Sylvia says, thank you for sharing your wisdom. What is the best thing to do to get known as a sports acupuncturist? It's actually a good question. We've answered that before in some of our other webinars. Any one of you, what's your opinion?
I'm not sure what they mean by known as an acupuncturist. Are they meaning within the acupuncture community, or known in the community that you're treating people? I think the more important one is known within the community of people you're trying to treat, because that's how you're going to make your living, I suspect. And I think the best way is to do really good treatments. That's it. If everybody who's walking out of your office is like, that was the most amazing experience, you just don't need to do anything else, as far as I'm concerned. It might be a little slower build, but really good treatments, really taking care of your people, really giving them attention, really listening to them. That's the best way to go about it, hands down. So I don't know, but to get the door started, I joined a CrossFit gym and did CrossFit and hurt myself in the process.
Jenny, I know you've got something to say on this matter.
Well, I'd say I absolutely second that. Get results. And then communicate to your patient what you did so that your assessment, either like their movement was restricted, they had pain, their range of motion, whatever orthopedic assessment you did, and see a difference, they feel a difference, and now they're telling all their friends, and focus on just getting good results with people. And then it sort of takes care of itself from there. And if you all just know, all athletes need more support than they're getting. And so if you want, you can donate your time and reach out to someone and say, you know, I admire your work and I do sports acupuncture. And if you would like support, I'd like to sponsor you potentially if you have the time in your life to do something like that. And then if you get good results with that person, they're going to tell all their friends. So they'll say, I've got my guy. And then they'll text your information around.
Yeah, and the language I would use with what Jenny just said is that by giving some of your services for free to either a well-known athlete locally or to a running club where you go to their Tuesday afternoon runs, and anybody who needs, you know, pre or post treatment, everybody sees that you're doing this, and you get, you know, you get seen as acupuncturists for runners by donating to a club, or as Chad said, CrossFit gym or what have you. Just do something that is natural to you. This is what you do anyway. You're a runner or you're a snowboarder, what have you, and try to find a way to just give away some of your services for free to be seen in that world. And then, you know, people come to you and all that. Like, I think, Kenji, what about you in Marin County? Any additional comment on that?
Oh yeah, well, first off, I'd say the way that I started working with the local Division II men's basketball team was because Whitfield was on the same plane as the coach and the players coming back from Hawaii, or going there one way or the other. And so how opportunistic was that? I mean, he just started talking to him. Oh, you're the coach. Hey, you know, and then he, of course, sent them my way. And so that was one thing, you know, you're next to somebody, you never know who they're going to be. You talk to them, and lo and behold, it happens to be the coach of this basketball team. And then the other thing, the biggest thing that's worked for me is I joined with the idea of approaching the owner of this local yoga studio that just had tons of members. And sure enough, I said, hey, look, I'd love to see your teachers. And the key was a couple came, and yes, they got great results. And so if they didn't get great results, it would have been one thing. But if they did get great results. And so next thing you know, I had people coming like crazy. They're like, oh, you know, the teacher and blah, blah, were talking, and you talk about how great you were. And so I'm like, what, who's that? Kenji? Oh, okay, yeah. And it just snowballed. And so, you know, getting in first, I liked the idea of getting into my local community because I wanted to treat my local community. I do yoga. I participate at the studio, so I'm part of it. And then it becomes this great source of patients. So I would consider that getting yourself out there as being a sports acupuncturist. If you don't feel like yoga is where you want to get, believe me, a lot of sports injuries happen in yoga. Sure. But if that's not the route you want to go, then you can, you know, the local run. There's tons of running clubs here. My next, I've been introduced to the gentleman who owns the local running store, and so we're going to have more talks about that. So it's boom. It's just like that. Talk to people. Don't be afraid. See who's sitting next to you in the airplane. So
influencers, people who have big influence over their community, the running community, you know, running coaches, running store owners, the guys who are selling the shoes to people at the running stores because they're constantly talking to people. Just people who are able to influence people in the world that you want to be in, choosing the world you want to be in too. Like just knowing I want to work with runners, I want to work with volleyball players, I want to work with whatever, you know, and finding people who influence that community in your area and treat them. Get
Yeah,
them
the
on your table.
conversation happens because you're, hey, I love trail running. I go to the store. We can talk about all the local trails. We both know them all. So you have this immediate bond right away. And so, yes, absolutely think about where you want to go. If you've got the experience in the field, it's even better. So.
Wonderful, wonderful. What about this question? What are your most effective modalities other than needling, or in addition to needling? What are your most effective modalities? Any of you all want to comment on that? Manual therapy, huh?
I mean, I was a massage therapist before I was an acupuncturist, so I'm at 20 years of being a massage therapist this year. So my hands are my most skilled tool, I think, and I love my hands. However, in my quest to solve my Achilles tendon problem, I've really went more into the cupping and gua sha world than I have at any point in my career. So I think those tools are gaining some ground for me, but definitely my hands. I can't do without my hands. I thought I would never do another massage when I finished acupuncture school, but I spend half of every appointment doing massage work. So it's a great tool.
I was talking to both Jenny and Whit. I was like, gosh, these neck issues, Whit, you decided to put that little section about the neck, just the levator only. And which has been great. Yes, the levator is often involved. And one thing I started doing is adding this cupping technique. It kind of, again, it's about, you just start talking to people, you meet people. My former chiropractor used to share the office. He did ART. And it's this whole idea of pressure with movement. And so, so what you got to take these ideas that you see them work and you're like, oh, pressure with movement. And why not do cupping with movement? And so lately I've just been cupping the levator with movement, neck,
cool.
Side to side, ear to shoulder, and it just makes all the difference in the world. So it's revolutionized my neck treatments. So cupping, absolutely.
Bilateral cups or one side?
If it's bilateral neck pain, yes. If it's one side neck pain, then it's only the affected side. Mm-hmm. And it's just golden. And I love it because as soon as they start turning and all of a sudden you see that color just come to the cup, you're like, oh, bring it on.
Cool.
In my clinic, I use manual therapy, kind of movement, some corrective exercises, gua sha, cupping. Either I like the sliding cup or put the cup in place and do the active range of motion like Kenji's talking about. And I know Anthony Vondermol was on here and he has a nice class about that online if people want to learn how to do that. Shout out to Anthony. Yeah, I love all those modalities, but when I'm working, in a professional setting with other people, those people are doing all of those modalities except for acupuncture. And I don't want to step on anybody's toes and do those things, like when I'm at the facility, because that's part of their job. And so I pretty much stick to the needles. But the hands and the manual therapy it's part of my assessment, and before and after. So I can't get away without, putting my hands on people. Maybe also because I like it. And it makes me feel like I know whether or not my treatment worked too. So I definitely do that too.
Wow, good. There's a few questions in there. We'll get to them. Let's do the last question and see what you all have to say. So where did you learn some of these skills? What organizations do a really good job of helping to prepare the acupuncturists for sports medicine? Let's try to, we've got my program and we've got Matt Callison's programs, so we can mention those, but let's see if we can, let's see if we can put out some broad areas of where people can develop their fields. What else have to say to that?
All right, Whit froze, so one of us might as well talk. Yeah, so for me, like the inspiration for the anatomy stuff was probably Whit, as far as digging deeper and deeper into it when I was working with him. And then I got an opportunity to help Matt Callison set up a cadaver for a class he was teaching. So I like an 8-hour one-on-one like cadaver session with Matt, which was an amazing master's course in like understanding your anatomy to a whole different level than I ever imagined, and understanding where needles end up in tissue. So it was kind of like inspiration from Whit and understanding this stuff and how this could all be used with acupuncture, and then having that experience with Matt, which opened my eyes to a whole nother level of the specific acupuncture stuff that you can learn from doing classes in cadavers and studying anatomy stuff. Wow, we're losing people like crazy here. And classes that I've studied with. So Anthony Vandermeul, who's out here, is going to get another plug. He kind of started to get me to think about. So I've always thought about muscles first affecting joints, and the way he thinks about it through his lineage of learning is kind of, correct me if I'm wrong, Anthony, but kind of the opposite of that, of thinking of joints and ligaments first and how they affect the muscles and how we move and how our whole bodies move. And if you can correct that kind of stuff, then you make some changes. And that was kind of, he was one of my early like podcast interviewees, and it was really opening from a new thought process for me. So he got me thinking a lot more. So you can go in and listen to Anthony on the Pinpoint Performance podcast. I think it's on the Sports Acupuncture Alliance website. And I thought he was one of my more interesting interviews, because he talked about that. There was another person in a similar lineage, and her name is slipping my mind right now, but who kind of talked about the same stuff. But I thought that was a very interesting thing that I would someday like to study, but he's on the other coast, and I got 2 young kids. I'm not traveling much these days. All right, Whit's back.
Yeah. So what I think is interesting is that people really tend to start thinking that like everything is muscles. The trigger point, people think all pain is trigger points. The motor point, people think, well, you fix any problem by needling a motor point. What I really appreciate about Anthony's work is he talks about ligaments, and a lot of times it's not muscle tendon problem. A lot of times it's a ligament problem. And Anthony talks with considerable precision and on ligaments, which I think is really important piece to add to this. So yes, Anthony, that's a great contribution, and Anthony's a great place to learn. And I don't know what else.
He's got a whole program too. So
yeah,
you can definitely track his stuff down if you're interested in studying that stuff.
Yeah. And I think I'm not in the chat. Did I see that Anthony is?
He's here.
Yeah,
he's in attendance, so he's getting lots of plugs.
Good. So you all can. I don't read the chat, so I don't see that. So, but you all can look up Anthony, and Anthony's got some great material. So I don't know what else I missed while I got bumped out of here, but
just me trying to talk to. No, I was filling in. I was answering the question. I was figuring you were answering. Kenji gets to answer his question, and we lost Jenny, so I don't know.
Yeah. Sylvia says, "Who is Anthony?" Please look into the chat box and you'll see.
Yeah, Jeffrey posted a bunch of stuff already, so you can track his stuff down.
Yeah. So boy, we've never gotten most of the questions all done before 1 hour. We've always gone a lot longer.
Hey, I can add to that last question.
Please, please do.
Yeah. So, I actually started taking Matt Callison's course first, and then I saw that you were offering your course, so I was about to say jump ship, but that's not it. Then I wanted to take your course. And again, you get these great baseline of where I think everybody should be coming out of school. It's just like have this idea of just, to be able to take care of the majority of things that come into your office. And what Chad's podcast is great. What you need to do is listen, and you can pick out the people that you really like, and you just start looking them up, and you follow that little rabbit hole. Whenever you start seeing somebody or something that you're into, you just start following the rabbit hole, and you'll see classes offered. Well, now it's online, but hopefully in person again. And then a YouTube video, you can learn so much off of that somebody has put out. So, and again, talking to my physical therapist friend, and that's why I'm learning the most now. It's really just kind of these little tips here and there that I kind of put in here, and some get lost, some stick. Hopefully the good ones stick, but yeah.
So someone's got a question here. How do you market yourself to be a sports acupuncturist outside of word of mouth? I think we've answered that question, but you've asked the question, which then means that the answering of that question wasn't sufficient for what you wanted.
I have something to say.
Yeah, please.
Yeah, just don't treat the other conditions. Refer them out to other practitioners in your area, and then call them up and say, hey, I referred this allergy or gynecology or fertility patient to you because I don't treat that, but I do focus on sports and orthopedics. So if you have anybody that you're in the weeds with or don't know what to do with, send them my way if you want, I'm referring out all the time to people, and to PTs and to personal trainers, and you start sending people out to other people, they start to get to know who you are. I have a few doctors that I send for regenerative medicine, injection therapy, ultrasounds, surgeons that I know and like and track. And, once you start sending people out, they start coming back by referrals.
Completely second that. Like the more, it's hard to do in the beginning.
Give it all away.
I get it. It's super hard to do in the beginning, but the more you do it, the more you send people out, the more people come back. I mean, I send people to other acupuncturists all the time, probably not daily, but definitely weekly. I'm sending, somebody to another acupuncturist in Philadelphia, or, somebody who's, I just had somebody who was out, in California who I thought we were going to need to emergency send to Jenny, but she made it. So, but I treated somebody tonight who's going to be out in in Northern California or in the Bay Area for 3 weeks, who very well may end up at Jenny's office. So,
and that's the other thing is that, once you kind of stay connected in this group, we want to know who you are so we can send our people to you, because we don't want to send them to just anybody. Once they've had treatment that's specialized in orthopedics, we want to know, who do you have in Atlanta? Who do you have in, I have a player who just went to the Falcons and he's asking me, who do I see? I'm like, we need to know who you are and what you do. And so stay connected in our community. Chad does the conference sometimes, not lately, but he will again. He will one time in the future. We'll have a conference again for sports acupuncture, but stay connected. I stay connected with a lot of people on Instagram. That's a platform I enjoy. So, if there's a way you like to connect with people, connect. because we do want to know so we can share patients, because we can't, people move, and we're a community.
Good. I wanted to comment back to the beginning. You also, I think, eloquently talked about the importance of listening, and Jenny was talking about these athletes just saying, God, nobody's listened to me, like this. And I want to make sure to kind of qualify, that listening is part of a process that to differentiate yourself from just being a pain treatment, pain doc, or orthopedic doc. That in sports medicine, you want to know the psyche of the patient. You want to know what's going on with that athlete. And so when you're listening, of course, for simple, important signs and symptoms, but also emotional, psychological signs and symptoms. But the listening comes with knowledge about the athlete and what they're doing. You need to know what this athlete is doing. So if you're in the running community, you need to know about long, slow distance versus slow, fast, interval training or cross training of any way. If you're dealing with snowboarders or skiers, for instance, there's a whole different set of weight room work and what have you. So every athlete has yin and yang style training. Yin of very easy type of training, and yang very intense type of training. And you got to mix the two together for a good training program. But all of that is what you listen for. You listen and you understand. And so when the athlete hears you say, well, I'm concerned that maybe you are overtraining, you're not sleeping, your pulse is a little rapid, I'm concerned that you're overtraining. Being able to speak to the athlete patient from your listening, to translate your listening into some sort of recognition of who they are. It's important to make sure you get very well versed on what the athletic event is and what the training is for this patient. Maybe they're just running and they're not trying to do anything, but we're talking about they're not trying to do anything other than run. We're talking about athletes who are training with specific, goals in mind, and so, but know the language, know the language and know what that life is like for whatever the athlete is. There's things like Jenny has treated lots of rugby players. I don't know anything about rugby players except they really get beat up a lot, but I don't know rugby players. I know marathon runners, and so it takes time to learn about the life that each of these athletes has in terms of training and recovery and rest and what have you. So make sure you spend some time reading, not just about the anatomy and not just about the injury, but learn about what the training and the competing and the training and the recovery is for athletes, no matter what they're doing. So, because you can be sure there's too much yang. You can be sure they're overtraining most of the time. They're doing too much.
If you don't know, because Whit's saying know how to talk to them. If you don't know, ask. So what do you need to do? What positions do you need to get in? What are you struggling with? What hurts when you do, what's your repetitive motion essentially? Because I've never played football. There was 8th grade powder puff, but that's not so I definitely don't know, what these different positions really need in their bodies until they show me. And so, you know, I have them get down in their stance and, okay, well, when do you start to feel it? And let me watch how you're moving and what happens to your knees and are your hips rotating? And, you know, so, you know, is your back not able to get that flexibility for a wide receiver? How's your spinal rotation? How's your reach? You know, so like, I have never done any of those things, but I'm asking people, what do you do that you need to do better? And they show me, and they're happy to show me. So, so if you don't know, you can learn. So
yeah. On that note, study like YouTube clips of whatever sport you're watching. Like, how are they moving? What are they doing? You know, really break things down into like understanding movements. The more you understand that movement, you know, the better. For me, I just play every sport known to man, so I keep trying them, and you know, I can have a conversation with just about anybody because I've at least tried almost every sport and hurt myself while I was doing it, most likely. So get out there and do stuff, you know.
Chad was a quarterback in college, and to entertain me once while I was recovering from surgery, Chad brought over these. They were probably VCRs at that time. It was so long ago, and we were watching the state championship football game. You know, with Chad being the quarterback, and we're just sitting and watching this poor film quality of.
It's horrible.
It was hilarious.
Dots.
It was so much fun to watch, you know, and long passes. Chad had this real tall, you know, receiver, and he just throw the ball up, and this guy would grab it, you know, and so it was fun watching Chad play quarterback. So, at any rate, neither here nor there.
Oh, what was I going to say? A bunch of people are asking who Anthony is. So go look in the chat section, and Jeff posted, you know, links to Anthony's stuff. So Anthony Vondermoel, I'm sure I pronounced that wrong. Sorry, Anthony. But and then there was something else I was going to say on this topic. Oh, you know, I think I've kind of said this already, but I read a book when I moved back from Boulder the last time. I think it was basically like, I think the book was called Book Yourself Solid, which is kind of a corny title to me, but the basic synopsis of it was, find the people you want to work on and go after those people and ignore everybody else. Like the people and then fire the people you don't want, essentially. So when I came back to Philly, I had run a personal training and massage business. I had all these like uber wealthy people who could afford to just, you know, get massages after their acupuncture or after their personal training sessions, you know, and spend hours at their house. And, you know, most of them do not know I moved back to Philadelphia because that's not the work that I wanted to do anymore. I wanted to work on athletes. So I cleaned the cupboards of all of the people who were not focused on some sort of fitness goal. And that's the only people I went after. You know, do I treat some moms with knee and hip replacements? You know, definitely. But I work pretty hard to stay in the sports world, you know. So staying in that world, I think that's Jenny and I's kind of synopsis of what the best marketing is. You know, I don't do any of, like, I'm too old to be doing the social media stuff. Somebody just followed me. Sorry, you'll never hear from me on my Instagram account. Sorry. I think there's 4 posts on there in the last decade. So that's a way, but that's not my way. Anybody else?
Do we have any final comments or
well, there's a question on there that I kind of timed out for a minute, so I don't know. There was, what type of needling theory or technique do you use to treat athletes? Did that get answered?
No. Why don't you start that? Yeah.
Oh, so I mean, I think the beauty of it with acupuncture is you can use, you know, Chinese medicine is such a beautiful system, and I sort of use that in addition to local points, trigger points, motor points, neurofunctional points, but then I will, you know, think about the channels and yin tong and, you know, affecting the nervous system you know, like the shoestring points and the Jingwell points. And so I think there's a place, and I know Kenji got really into SOM acupuncture and was loving that and adding that to the orthopedic treatments. But so I think whatever it is you love doing, as long as you can also assess the orthopedic issues and know how to treat the significant tissues in those regions to change that area, you can integrate all the other stuff as well. So my personal preference with needling is to use very thin needles and to just place them, you know, after real careful palpation in the depth that I want, and attach like a light current e-stem. I usually use an e-stem 2 machine, and sometimes I use a pointer plus pen to stimulate a needle. And I love that. And it's very gentle on the athlete. And so most of my people, they have a small window for recovery and a huge amount of yang activity in their life. And so I'm trying to maximize recovery without creating, you know, new injury to the tissue, new inflammation, new problems. So I have to be really, really stealth mode with my needles. So I try to use as few needles as possible for the orthopedic issue, and just get right into the space I need to get to when athletes need to be game ready. If it's in the off season and there's like a bunch of scar tissue or adhesion or something we want to break up, okay, that's a different thing. We can afford a flare up, but usually I'm pretty stealth mode if I can be. So that's my style, which I generally learned from Whit.
But in general, the answer to that question, what type of needle theory technique do you use? It, you know, it varies. Everybody is going to be able to can do this using the technique that they're familiar and comfortable with. So there isn't a right way to do anything. You can use very aggressive pecking and rotating, or very stealth, just placing a needle with almost no sensation. There are so many different techniques that one can use. I don't think that there's a right answer to that question. Well,
I remember, you know, when you were teaching at ACTCM, and that time when I got to help you there, and you were getting some flack. And I think the idea was that people were making the assumption that you were much more of a dry needler style. You know, you're going for anatomy only. And, you know, that's obviously so incorrect, because the way your whole book lays out, the way we teach every time, is that, you know, you have these steps. And these steps go back to, you know, your traditional teachings and the traditional books that you have studied and the teachers you have followed. For instance, the cross shoestring points, and using L.C. And so the idea that there's only one technique is, like you say, totally wrong. And then in that you do it, you know, a certain way is totally wrong. And then I found that what I was starting to do is making the mistake of becoming that same dry needler, where I was like, okay, I'm just going to be, you know, I've got this anatomy, I figured out this muscle, and I'm going to needle that muscle. And so I was becoming a dry needler myself, and it just doesn't work. And so you got to come back to the fact that you're a Chinese medicine practitioner, and you have so many tools that you can use, and you know all these other theories, channel theories, the Jingwell, and you use all that. And another, you know, having training from a Japanese style teacher. So one thing that I've been to have a science background, you play around with all these techniques. And so one thing I've been thinking, I always used to say when we're teaching, I'm like, oh, you got to get into that glute minimus. You got to the medius, yes, but I want you tapping into that minimus. But then I started thinking about the techniques we do on the pecs here, where, you know, oh, remember how you get to the pectoris minor, you innervate the pectoris major. And that helps, you know, has this interaction with the minor. So now my idea is, what if so if I just don't get to the glute minimus and I just do the glute medius, am I getting to the minimus? And so you just keep playing around with all these things. Sometimes you do, sometimes you don't. And the E-stem and E-stem.
So I'll answer a couple of these questions over here.
Please.
So actually, I think it's really up. You know, I base what I do with a needle off of the patient. So every patient is different. Every patient has a different sensitivity level. Every patient has a different response. I obviously learned from Whit, how to needle, and so it was like skinny needles, like 75 millimeter needle that is like freezing up. 0.22 actually.
0.22. Yeah.
0.22. Sorry, totally froze. So, I'm using this really skinny needle to go in there and just sneak as much as I can. But there's people who, really, really respond to me going in there and like searching around and getting some twitches, and discovering who works best with what. Obviously, you start with the gentle and you work towards the, more aggressive stuff. But I have people who that's really why they come in and what they want. But it took us a while to get there, but you really have to learn what each patient can handle. Some can handle E-stim, some can't. Actually, I'm using less E-stim now than I've ever used in my career post-COVID for some reason. I don't know why it happened, but I'm discovering like I can get some of the stuff with just needles and not E-stimming people, and it's too much for some people. But some people need a lot. So you got to really like pay attention to your patients and like talk to them. And, it's hard now with masks on, but like paying attention to their facial expressions while you're needling them. Now you can just watch their eyes. What are they doing with their eyes? Ask them questions, communicate with them. The more you talk to them and, have interaction with them and pay attention to them, like, are they twitching? Are they flinching when you put a needle in? Are they just chill out? And you can learn a lot about what you can do and what you should do with each patient by paying attention to how they do. So we got the needle size. We got do sarin work well for sports acupuncture? I don't use sarins, but I've used them some, and like the idea that you need this like thick, needle that's got sharp, jagged edges on it to like catch tissue and be able to like pull up and get that tenting effect. I have an awesome video somewhere of me putting a sarin in, not twisting it in any way, and then pulling that needle up and getting a huge tenting effect. Jeffrey wanted me to send that to them. I don't know if it ever happened, but so you can get that. Like if that's the effect you're looking for, you can get that with a sarin needle. Maybe that's just a style of how you're needling or something, but you can get a huge tenting effect. I didn't even twist those needles. I just put them in, let them sit there for a while, and then pull up on them, and just a huge tenting effect. So you can use a sarin needle if that's your choice. It's not what I use, but if that's what your choice.
I just had a sarin experience where I was trying to thread the lateral epicondyle, and I had all these 1.5 inch sarins around, so I'm like, oh, I'm going to use that. It's an ivory. And what happened is the needle is so stiff that it actually popped out of the skin, where I'm used to the Korean needles that are nice and soft, and it always follows the tissue. And so that was an interesting idea. I was like, oh, so that, if I'm going to thread, I'm not interested in the needle popping back out of the skin. Call me crazy, but so that I know that some of those new needles for sports acupuncture, they claim, oh, we're stiffer, and the idea is, okay, we're going to get right where you want to go. But I actually love the idea of the thinner needles that actually kind of move with the tissue, and it makes a huge difference.
I use sarin needles 50% of the time. That's probably half of my needles are sarin needles. The other half are other needles that have polished shafts like a DBC or a MAC. I never have a needle that does not have a polished shaft like a Carbo or any of those less expensive needles that the metal is not smooth. I want a smooth needle that will pass through the tissue without a lot of event. So that's my style. There's different styles. Jeffrey, come on back.
How you doing, guys?
Hey.
All right. Well, thank you so much. That was incredible. There were some great questions and, really just great information. I know everybody in the audience is extremely thankful. I want everybody to know that you can visit the L.OMS website. We have 15% off top sports therapy products right now. One of those products is Whit's book. So check your email 5 minutes after we end and you can get your copy. Also check out some other top products that are on sale. Our next webinar is going to be happening on November the 16th. It's featuring Shelley Goldstein, and it will be Cosmetic Facial Acupuncture, Managing Patient Expectations, Communication, and Increasing Retention. So don't miss that. Again, thank you to everybody. Thank you to our panelists. Thank you to Whit. And we hope everybody has a great night.
See y'all. Thank you, Chad, Kenji, Jenny, and thank you so much, Jeffrey, for hosting us.
Oh,
thanks
thank
everybody
you
for attending. Jeffrey, thanks, Lhasa. Love you guys.
You guys are welcome back anytime.
All right, bye-bye.
All right, good night, everybody.